Right. Hello, thank you for attending our conference around PatientLeaf. What I'll do is, so my name is Raza Tuzi. I'm a GP in Wallington, part of Sutton CCG. Been around for a little while, developing software for EMIS, at least the last 13 years. And we've been working on PatientLeaf for a few years now, but I thought the time's ready to release it to the public. I've also got a master's in IT, so hopefully that helps with the development of this. So this is sort of my baby, as it were. I blog occasionally on razatuzi.com, but you can contact us on patientleaf.com. I think easy will be sending information around post-session. So in this presentation, we're going to just give you a whistle-stop tour of the product. I've just got one slide, if you're happy to know, about the product. I'll show it to you, how it works, and then we'll go over a few anonymized patients for you to get a feel of how it actually fits into the way that you work in your clinic. So what is PatientLeaf? So the idea is it's an upgrade for the EMIS user interface. A few years ago when I was in clinic, I sort of realized that it's very difficult to try and get the information that you need in EMIS in the time that you need it during the consultation. And what I think PatientLeaf does achieve is to try and get that information in a very succinct way for you to make a sound clinical decision in a timely manner. You could call it a real-time clinical support tool, which again allows you to get information that you require. In this world of information overload, what are you trying to simplify the patient record with PatientLeaf, just to get that nugget of information to make a right clinical decision? Think of Bloomberg for clinicians. So key points are that it follows nice guidance tailored to the patient. So we extract all the patient's notes, we look at the condition of the patient you're viewing, and then we overlay nice on that to tell you what the ideal target should be for that. It's very patient-centric. In my travels with PatientLeaf, one thing I realized inadvertently is that it's very patient-centric in terms of showing the patient the information in front of you and actually discussing the condition with them and complimenting them where they're doing well and advising them where they need to improve. It's good for checking high-risk patients. We have CCG in Birmingham, which is looking to use it to try and identify high-risk patients on their risk load. And there's a case study, actually, if you look on the webpage, all around that. It's important to check compliance with patients. I've realized one of the huge issue is around if actually taking the medication. This can be quite difficult to pick up on with EMIS. So we'll go with that and see how it helps compliance. You can data mine within seconds the information that you need. That needle in the haystack, that bit of key notes in the path of medical history that tells you exactly what's important for you to make a clinical decision. Attachments are viewed very quickly. You can look at attachments within a few button clicks and view multiple attachments at the same time. With DocMan around and the cloud-based technology, it can be a bit slow to view these, but it's quite quick with PatientLeaf. And all within a futuristic modern look. The way we'll work on this, because the demonstration now, is that I'll take any questions if need be as we go along, or any others which we'll look at in between patients, and also at the end, if any lingering questions, we'll happy to fend those off as we go along. Okay. So the way it works is that when you're in clinic, you change the patient in EMIS, and then automatically within a few seconds, this box appears. Okay. I like to put it sort of between the patient name and the date of birth. And what the PatientLeaf does is that it trawls through the patient's notes and it works out which conditions that should be shown on this toolbar. Each condition represents a leaf or a button on the toolbar. Okay, this is a test patient, so we'll just go over what the interface shows. And to actually view the product, you just click on the appropriate leaf. So let's click on blood pressure. When you click on that, you are dealt with this view. We'll go each section in turn. As with this product, it's a bit different to the normal .NET app with menus and drop downs. So you need a bit of training to try and get up to the grips with it. But once you've learned the ropes, you'll find it's incredibly useful for you within your clinic setting. And that's the important thing. This is a product which you use within your clinic while you're seeing patients in real time to make better clinical decisions, just like an upgrade to the EMIS UI. The top area shows demographics. This area here shows the blood pressure, since it's a blood pressure leaf. Anything above the green is not good. Anything below the green is good. If I roll over here, it tells me this patient's had a previous history of stroke or TIA. So it's actually worked out based on NICE that this is the optimum blood pressure. This will change depending upon the patient's profile, which is quite a useful feature to have. Roll over here tells me when the condition was diagnosed, and this area shows me the compliance and actually back each spell and which medication has been tried based on blood pressure for this patient. If I roll over this question mark, is the compliance key. So green is compliant, blue is underusing, and red is overusing. If I roll over any notch here, it automatically takes me to that point in time in this section here, which is the medical history. If I left click and zoom, keep depressed, I zoom to the actual screen to show me each individual issue. If you notice, it was green. If I zoom left, it's red here, which he's overusing here, but under there. On the whole, it averages out as him using it appropriately. So this way you can easily kind of pick up on issues with the patient and what they're using or not. One useful thing to do is look when a medication stopped when it started, and then hover over the notes to see why that happened. And we'll go with some examples as we go along. This section down here shows any coded data linked to blood pressure. So like I said, it takes a slice of the patient's notes based on the condition that you're seeing the patient for. This is all related to blood pressure. And then this area here shows all attachments, which again are related to blood pressure. As you can see, you can quickly flip between attachments and view them accordingly. There's also an attachments view, which I can show you, which shows you all the attachments that the patient's ever had for you then to sort of click on again and view as you see fit. Okay, that's a general overview of the user interface. Let's go over a few patients. So the way you do it is when a patient comes in clinic, like I said, you click on the you click on the screen. The patient automatically appears in the screen in front of you, and then it'll be viewed, and then you're able to sort of click on the appropriate leaf accordingly. So this patient was related to compliance. Okay. So this patient's very interesting. What happened was that he was due a laryngoplasty, and his dentist told him that he needed to change his amlodipine because he had gum hyperplasia, and he had a high blood pressure and came to me in clinic asking me to manage his blood pressure. With EMIS, with this type of patient, it would be actually very difficult to do because he's been a whole myriad of medications, each different doses, and trying to unpick this would be quite difficult. With PatientLeaf, once you get to use it, it's actually quite easy to pick up. So what happened was that he was on odoxazicin here, which was changed to spironolactone by the renal clinic, and then stopped for some reason. If you notice, he was also on candesartan, which was down titrated and up titrated, and here the amlodipine that was stopped. Of note, if you notice, some of the lines were blue as well, which indicate that he actually hasn't been using the drug that frequently, and this was highlighted to him with good effect. So clicking on there, you can see the gaps in between each issue. So with this patient, we basically, I decided I could have increased the losartan candesartan, sorry, and asked him to take it. But what I said was I just restarted on doxazicin, since the reason why it was stopped before was because he was changed spironolactone rather than any other reason. And then with good effect, and that really helped improve his blood pressure for the success for operation. Okay, let's do the next patient. So as you can see, within a very short space of time, once you get used to the user interface, you're making quite good clinical decisions on on this big issue about blood pressure control. Same patient again. Let's go on again. Sorry, this is the same patient we spoke about before. So we'll just move on to the next one. So as I said, any questions, do let me know. Happy to fend them off accordingly. We'll go over patients as we go along. Yeah, and issues will come back to me. This is a very good patient around how we can simplify patient-centric care. So this patient came to me with a diabetic review. If you notice, since he's been started on glucoside, his HbA1c has dropped quite extensively, and showing this to the patient has a really nice effect on viewing how his condition is affected by his medication. Also, if you see the cholesterol levels were very erratic until recently when he was started on rosuvastatin. So again, complimenting him to say that since you started the drug, the levels have gone back. If the views look a bit busy, you can automatically overlay on a particular line and select and unselect what you like accordingly. So yeah, again, very good way of showing the patient. And one thing I realized with PatientLeaf is how patient-centric it is, showing the patient the condition. Again, this patient is very compliant with medication, so it's good to show me if you're taking the medication, this had a good effect. Notice the ACR was a bit high there. Let's see where that was. Click there. You see you probably had a UTI. So again, you can pick up on these things quite quickly and easily and safely, which is the idea of what we're trying to achieve with this product. Let's go on to the next patient. So yeah, so we like to think that this product helps you in your clinic to try and achieve what you want to achieve. So this patient had an issue with compliance. It's quite interesting actually. So if you notice, this patient's HbA1c has been tethering up and down for a little while. We started on medication, and by the end, he was actually on a full house on all 4 drugs: metformin, oxalgia, linagliptin, and glucoside. And in the normal world, we would have probably started him on insulin or referred him to the diabetic clinic. If you notice, these areas are blue or kind of turquoise here. And if I drill in, you can see there are lots of gaps here. So instead of that, it was simply telling the patient, you know, looks like you're not taking these drugs, could you please take them, and monitoring his HbA1c accordingly. So in this case, we actually avoided referring him for insulin based on this product to try and help him achieve compliance, encourage him to achieve compliance based on the lines of what we saw here. Also, one small point is that with HbA1c, PatientLeaf merges the IFCC and GCCT levels, so you get an overview of the whole of the HbA1c since you see a dot rather than a gap, because the values changed over time. I don't think we've got time for one more, but we shall try. Okay, no, I don't think we've got time for one more. So hopefully, with this whistle-stop tour, I've shown you what the product does, how it works within your GP setting, and how it can effectively make clean, clinical, effective decisions which are safe, but also within a timely effect.